Mr. Benson is refusing treatment and transport for a suspected myocardial infarction. He has provided the paramedics with an advanced healthcare directive and informed them why he is refusing. However, his daughter Jenny is his designated health attorney and wishes for Mr. Benson to receive treatment and transport. Our problem is, who has the authority to make Mr. Benson's healthcare decisions? Here are the facts. Mr. Benson is 69 years old and in otherwise good health. His wife recently passed away. He has a good relationship with his GP regarding health concerns. One day, Mr. Benson was feeling unwell. He called his daughter Jenny, who consequently called an ambulance against his wishes. Mr. Benson immediately informed the paramedics he did not want treatment or transportation, but was compliant with their question and assessments. From these assessments, the paramedics informed Mr. Benson he was likely suffering an acute myocardial infarction. Mr. Benson voluntarily agreed to the administration of oxygen and sublingual nitrates upon their advice. Mr. Benson still refused further treatment and transportation, providing the paramedics with a copy of his advanced healthcare directive, and informed the paramedics he would heed their advice to see his GP. Jenny was informed of Mr. Benson's decision, but believed that as his health attorney, the paramedics should comply with her instructions. Let's consider the principles of bioethics and how they relate to Mr. Benson's capacity to make informed healthcare decisions. The first principle of bioethics is autonomy. According to Townsend and Luck 2013, autonomy is the respect for the individual and their ability to make decisions about their health and future. In addition to this, the World Health Organization and Australia Charter of Healthcare Rights highlight that the patient has the right to make decisions about their care. Autonomy is the principle that provides the basics for informed consent or refusal of care. To uphold the patient's autonomy and right to make healthcare decisions, these three conditions must be satisfied. Liberty. Mr. Benson was free from controlling influence when he made his decision to refuse treatment and transport. Understanding. When Mr. Benson decided to refuse treatment and transport, he was well informed about the condition he was likely suffering, what the paramedics believed to be the best course of action, and the likely consequences of not following such medical advice. Agency. In Mr. Benson's case, there are a few things to be considered to ensure he did have the capacity to make an appropriate decision. His mental state. Given the recent death of his wife, it might be argued that there is a disturbance in Mr. Benson's mental capacity, thus resulting in an inability to make reasonable healthcare decisions. However, Mr. Benson's behaviour does not indicate an immediate risk of serious harm because he has no thought of suicide or history of attempts, and he has a good social support through his relationship with his daughter. The grief Mr. Benson is experiencing over the death of his wife is normal and to be expected. Over the 80 minutes that he spent talking with paramedics, he appeared reasonable and justified in his decisions. There was no evidence of a major disturbance in mental capacity. Although it is accepted that Mr. Benson requires medical treatment for his suspected MI, it is not deemed that he has a major mental disturbance requiring treatment and therefore can refuse treatment for his suspected MI. Furthermore, Mr. Benson was administered GTN. Despite it being contraindicated by his low blood pressure, this may have impaired his mental capacity. However, the paramedics sat and spoke with Mr. Benson for 40 minutes following its administration and observed no adverse physical side effects. According to the QAS drug therapy protocol, GTN has a duration of 20 to 30 minutes. Thus, this would have been sufficient time for the effects of it to subside. Although the GTN did not appear to have caused any physical or mental disturbance to Mr. Benson, its administration was still contraindicated and thus did not uphold the bioethical principle of non-maleficence, which states that, as far as possible, you should not harm a patient, either through action or inaction. This raises the argument that if the paramedics were to not transport Mr. Benson to the hospital for treatment, would their inaction cause further harm? And should we not, as far as possible, do all we can to help our patients also? In Mr. Benson's case, respecting his autonomy and healthcare decision is the best way to uphold the ethical principles of beneficence and non-maleficence. Paramedics Australasia Code of Conduct and National Code of Conduct for Healthcare Workers in Queensland highlight some key principles and values healthcare workers should aim to uphold in their practice. Of significant importance in Mr. Benson's case is respect for Mr. Benson's decisions regarding refusal of treatment. ensuring consent for patient care is obtained and respect for consequent refusal of consent. In the case of Schloendorf versus New York Hospital, 1914, it was determined that every human being of adult years and sound mind has a right to determine what shall be done with his own body. We have determined that Mr. Benson was of sound mind during his interactions with the paramedics, and thus is entitled to make his own decisions to accept or refuse treatment or transport. Mr. Benson fulfilled the Virchow criteria used by paramedics to determine capacity, thus validating his wishes to refuse care. Mr. Benson voluntarily made his decision to refuse transport. He was not influenced or coerced by another person to make his choice. The paramedics informed Mr. Benson of their clinical findings and possible diagnosis, and advised him of their recommended course of action and the possible risks associated with the refusal of definitive care. So Mr. Benson was informed when he decided to refuse treatment and transport from the paramedics. Upon being informed of his current condition, Mr. Benson refused the recommended treatment and transport against professional advice. He cited his Advanced Healthcare Directive, stating that irrespective of the circumstances or condition he was suffering, he did not want any life-sustaining measures. By these measures, Mr. Benson clearly had the mental capacity to make his own healthcare decisions. Despite refusing treatment and transport from the paramedics, Mr. Benson was willing to heed their advice and visit his medical practitioner the following day. We can see clearly that Mr. Benson has capacity. An Advanced Healthcare Directive is a formal way to give instructions about your future healthcare. It comes into effect only if your cognitive health deteriorates and you become unable to make your own decisions. Thus, if Mr. Benson were to lose capacity, no life-sustaining measures could be performed. However, the Powers of Attorney Act 1998 allows an adult to make arrangements for future substitute decision making on their behalf in the event that they have impaired capacity at a future point. So, in the event that Mr. Benson were to lose capacity, his daughter Jenny would be responsible for any healthcare decisions short of life-sustaining measures outlined in Mr. Benson's AHD. At this point, we don't believe Mr. Benson has lost capacity. However, in an alternative scenario, if the paramedics deemed that Mr. Benson did not have mental capacity, example due to his mental state or the negligent administration of GTN, then Jenny, as Mr. Benson's appointed healthcare attorney, would have authority to make Mr. Benson's healthcare decisions, but she would not have the authority to overrule Mr. Benson's Advanced Healthcare Directive. We believe that Mr. Benson was of sound mind and was not adversely affected by the negligent administration of nitrates, thus had capacity to make informed decisions regarding his own healthcare. Given this, Jenny did not have the authority to enact her decision-making authority as Mr. Benson's enduring power of attorney. We draw on the conclusions made from the case of Brightwater Care Group, Inc. versus Rossiter, 2009. Confirms the clear common law position on the right of self-determination. The right does not devalue life, rather places an emphasis on recognizing that individuals can make choices regarding their own bodies. It does not allow a patient to receive euthanasia, but to decide whether or not to receive medical treatment. It would appear that while the right to life or the right to die are elusive, the right of self-determination is well entrenched in the Australian system of law. Thus, Mr. Benson is within his ethical and legal entitlements to refuse or consent to medical care as he wishes.